Don't ever staple this. Don't ever staple. I don't have to put a paper clip in it. Good morning. I'm going to go ahead and start this morning and indicate that on Wednesday, members of Congress joined me in asking the President of the United States to put in place the Defense Production Act for the production of the vaccine for monkeypox. Hospitals have been calling, clinics have been calling my office. The city of Houston has raised its concern, as well as Harris County. I'm going to start again because I'm trying to see whether we can avoid the beeping. And you want to get your sound, you know,
yeah,
is it not right in?
No, it's good.
Okay.
We're good.
So you cut that, guys? Yeah, I didn't realize that. Tell me that that's not bothering you. Okay. Then let me start again, if you will. On Wednesday, several members of Congress joined me in asking the President of the United States to enact the Defense Production Act in the production of the monkeypox vaccine. The city of Houston has raised its concern as it relates to the city health department. Harris County has declared an emergency. And just on yesterday, the President of the United States declared a national emergency with monkeypox. Let me be very clear that there are specific populations that monkeypox may be in. But monkeypox is not spread by sexual contact. It is spread by contact with the skin. And so these members of Congress, Madeleine Dean of Pennsylvania, Robin Kelly of Illinois, John Garamendi of California, Dwight Evans of Pennsylvania, Mondaire Jones of New York, Jim McGovern of Massachusetts, Steve Cohen of Tennessee, Dina Titus of Nevada, Mr. Green of Houston, Sean Casten of Illinois, Mike Thompson of California. This is a wide range of members from across the nation who indicate that the small company in Denmark and the small production is not meeting the surge in need. There are individuals seeking to be vaccinated who are vulnerable, who are being turned away. As I indicated, in my own congressional district, 3 people showed up at a hospital clinic. More are showing up. They had monkeypox. That means that in the sphere of influence that they've had, they have to know where they had skin contact, but it is not only skin contact, it is also clothing, it is also bed sheets, and it is contagious. And so the total CDC reports that there are 559 cases in the state of Texas, 26,000 global cases, and 7,000 confirmed cases in the United States. New York has 1,748, California has 826 cases, Georgia has 544, Florida 577, and Illinois 571. We're in the middle of the summer season of travel, and the key element of my concern to have this amount of vaccine not be stifled by the international supply chain that might not allow us to be able to have what we need. Again, this illness is not a sexually transmitted disease. It can be transmitted through close, intimate contact where skin comes into contact with infected skin or fluids. And it can come and occur when the skin comes into contact with infected materials like bedding or clothing. So even clothing, washing clothing, means that you could get this. The order follows a July 1, 2.5 million doses will begin arriving in strategic national stockpiles. That will not be enough. Deliveries from the 2.5 million dose will begin arriving in 2023. That is why I believe we should produce those vaccines in the United States, because the order that was just given is not due until 2023. This is a global disease. There is a global demand. That is what happened with COVID-19. We didn't understand COVID-19. The testing protocols started late, and that means that many people had already died not knowing what kind of disease they had. Emergency rooms were sending COVID patients away, saying they had a cold, they had the flu, take an aspirin, and go home. Those persons, well known, documented, particularly in New York, died in their homes because of the COVID disease that they had. As of July 22, 2022, a total of 900 confirmed monkeypox cases, a designation established by the Centers for Disease, had been identified, and 839 were identified in New York. The Houston Health Department announced on Friday, July 22nd, 2022, that they had received a shipment of 5,000 doses, and they had provided 1,500 to Harris County Public Health. I have reached out to the state of Texas to try and find out about the supply for hospitals who are asking, and guess what? They don't have enough to give to the many clinics, outpatient centers, and even hospitals in rural communities. That means that we are undercount for these vaccines. I want to be very clear that the President certainly has recognized the importance of monkeypox because, as you well know, he declared, as I said, this a national health crisis. Monkeypox infections are these: fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters that appears on the face, inside the mouth, and on other parts of the body, like the hands, feet, chest, genitals, or anus. Sometimes people get a rash first, followed by other symptoms. Others only experience the rash. Let me say to those who may have any of these symptoms, immediately get to your health provider. And this is the concern that we have. There are no treatment specifically for monkeypox virus infections. However, because of genetic similarities in the virus, antiviral drugs used to treat smallpox may be used to treat monkeypox. The main idea, the main treatment is vaccination. That is the key treatment, and the main reason for moving the Defense Production Act and asking the President to implement it and asking the Centers for Disease Control to implement it is we don't have enough. We do not have enough vaccine. Texas is a huge state, and we are parceling out the vaccines now. We don't want people coming that believe that they are vulnerable to seek a vaccine, and of course that we are not able to provide it. As the chair of the Congressional Bipartisan Task Force on Coronavirus, where we work with Dr. Fauci and the Centers for Disease Control throughout the pandemic, asked for more test kits, asked for more vaccines, asked that those vaccines be ramped up and produced, and asked that they be produced by U.S. companies, at least manufactured here in the United States. We asked that same for the monkeypox, and so I conclude my remarks by saying that in addition to individuals who might be exposed, we need the monkeypox vaccine for healthcare professionals, because at this stage of the disease spread, to keep healthcare workers available to provide care to patients who not only have monkeypox, but the COVID-19 virus or other health conditions and medical emergencies. If we had vaccinated all of our healthcare professionals, even that, we don't have enough. And so those healthcare professionals who want to be vaccinated on the monkeypox, it must be available for them. Monkeypox is not a single dose. You need 2 doses. So if you need 2 doses, that means that you need a lot. I want the state of Texas to have as many as they need. As school comes back, colleges, dorms, I fear possibility of a monkeypox spread. People in the, as they say, in the, how should I say it, in the dorms, students live close together. I may be sitting on my roommate's bed. They may be sitting on my bed. whole bunches of us may be in the room socializing, and monkeypox begins to spread. So there are many, how should I focus this? I don't want to call it opportunities, but there are many routes that monkeypox can spread. Remember, clothing, bed sheets, touching the blister. I hope that I will be talking to the Centers for Disease Control today, and I expect to push my call and the call of the members of Congress. And by the way, this letter that we have sent to the President, members are coming on the letter every day. They're coming on this letter every day. We, the undersigned members of the House of Representatives, urge you to implement the use of the Defense Production Act of 1950 to begin the mass production of monkeypox vaccine to supply what is needed to address the ongoing monkeypox threat to public health. Domestic production of vaccines will allow mass inoculations to begin and can help every American who needs a vaccine. The benefit of delivery of monkeypox vaccine in sufficient amounts to where it is needed is that the vaccine does good things even when given to someone after an infection has onset. That's a very important point, that the vaccine can be utilized if you have this as well. And as long as they continue to get sick, to get monkeypox, then we need it to prevent it, and we need the vaccine to treat it, because you can give the vaccine while someone has it, as well as provide longer-term immunity for monkeypox virus. If given between 4 to 14 days after the date of exposure, a vaccination may help reduce symptoms but may not prevent infection. And so the necessary supply is not here. We need it. And with that in mind, I'm hoping that we will hear soon a ramping up of the production. Dr. Shaw, who is head of the COVID-19 task force in the White House, indicated that he wants to see production here in the United States. A member of the United States Senate indicated they want production here in the United States. I believe our states are very large. The nation is large, 300 million plus individuals here in this country, and therefore we don't know the extent of monkeypox. We know that its fatality ability is lesser than COVID-19, but we know that it is infectious and that the scars that come from the blisters are lifelong scars. The scars that come from the blisters on your face, on your hands, on your body are lifelong scars. Let's stop monkeypox in its tracks. Let's have the vaccine for those who feel that that they are susceptible, that they've been exposed. Let's give the monkeypox vaccine. I'll take any questions at this time. Again, I'll be talking to the CDC, and I'll also reach out to the White House, in particular Dr. Shaw, that they are now reading this letter, and more members of Congress are coming on every day to say that we are experiencing a crisis in our districts and in our states. This last point, New York Times, as monkeypox spread, the U.S. declares a health emergency. I want to make sure that is clear. Monkeypox spread here in Texas, and health experts urge Texas universities to prepare for the outbreak. Universities to prepare for the outbreak. My friends, it's a crisis. It's not hysteria. It's a crisis, and we simply need to move forward. Let me see if there are any questions.
Are there any facilities in Texas that could make possibly manufacture?
There are facilities near Texas that could produce them and get them to Texas as quickly as possible. With the Texas Medical Center and the Baylor College Infectious Disease and the work that they're doing, I would venture to say that it's something that could be a possibility for the state of Texas. But I think the important point we make is to make sure that it is within the boundaries of the United States, because international supply chains did not work during COVID-19. And so if we have the ability to do it in Texas, we will do it. But if it's coming from Illinois, we will get it. If it's coming from California, we will get it. If it's coming from New York, we will get it. We want to make sure it gets in the boundaries of the United States of America.
How many cases have you registered until now? How many cases?
22,000 in the United States, 22,000 plus in the United States. And let me give you the numbers for Texas again, because I may have... there are 559 cases in the state of Texas. Globally, there are 26,281. According to the CDC, the total U.S. confirmed monkeypox cases are 7,102. States like New York, 1,748, California, 826, Florida, 577, Georgia, 544, and Illinois, 571. But they are growing. And there are going to be many places, universities. We're concerned about Texas universities. Universities are all over the nation. And so we're not prepared for that. And again, it's skin contact. It's skin contact. So we don't have to say it belongs in that population. Not at all. Anyone can get monkeypox by skin contact. Health professionals who are treating these cases can get monkeypox. Well, the vaccine would come to the state of Texas. That's how it's distributed. And then the state of Texas Department of Health and Human Services gives it to us, meaning to the local jurisdiction. The state of Texas doesn't have that much. And they're trying to give it out all over a state that has more than 20 million people. That's one state, California. They're desperate. San Francisco is literally shut down because they don't have enough vaccine for monkeypox infection. And so we don't have enough because it's not produced here in the United States, and the company in Denmark is a tiny, tiny company. It has to be produced here in the United States.
If they start producing it here, how long will it take?
That I will leave to the scientists, but my understanding is that it is a vaccine that can be produced expeditiously. Certainly, we have the Food and Drug Administration because we have the quality question that has to be asked, and that's why I believe it's important to produce it, because we need to get ready now, because we have to go through a number of confirmations in terms of the quality of the vaccine before it even gets the approval to be distributed. So if it's produced here, FDA, and they have to review it, we need to do that now, because I don't know what 2023 is going to hold us. Is going to hold for us. And also, we have about 2.5 million doses coming in 2023. That may be utilized in January. Because remember, I said health professionals, universities.
Well, and you also have some traveling, people are traveling more than ever.
That's how we got COVID-19. Europeans traveling into New York. That's the first cases of COVID. Very good question. Early in my remarks, I said that this is the summer season. People are traveling. They're traveling internationally, and they don't know who they may have come in contact with. Again, it's skin contact is a strong possibility, and the lesions, etc., can be very detrimental. So, let me say that I think the most important point I want to take away is that this has been declared a national health emergency by the President of the United States. It is an emergency here in our local jurisdictions, Harris County. The city of Houston has ramped up. We don't want to create a panic, but we want to show that we're prepared. The way we're prepared is we have our own vaccinations, our own vaccine. And to document that clinics are calling me and saying that people with monkeypox are showing up at their clinics and they don't have vaccines. And vaccines can treat you even if you have monkeypox. So it can treat you to prevent it or decrease it, and it can also while you have it. So if you've got the sick people with monkeypox, they needed a vaccine, and those who believe they might be exposed or that they are around individuals or touch clothing or sheets and otherwise, let us realize one group in our LGBTQ communities, but this is beyond any particular neighborhood. And to our Hispanic community, let me be very clear that we will have Spanish-speaking information for them at the City Health Department and Harris Health. The doctors indicate that wearing a mask is a good thing. When I was with the doctors about 3 weeks ago, they said wearing the mask is a good thing, but it is not a transmitted disease like COVID. It has to be touching. But they indicated that wearing a mask is a good thing because it's in the family of coronavirus, smallpox. It's a viral disease. So for those who wish to be safe, can be safe. I'm going to draw a line here for a moment and just say that how pleased I am, how sad I am for the what the world had to see with Brittany Griner. How painful it was, how sad it is, how people need to understand that Brittany Griner is still the same Brittany that went to Nimitz High School in Baylor, and that she responded to the place where she is. She responded to what Russia required. But yesterday I visited the Russian Consul General and gave a message to ask for mercy and pass a message on to the foreign minister to ensure that the negotiations began again. I'm so glad that now there will be some direct negotiations on the deal that has already been offered. And as I go back to Washington, I will be looking, if the deal has not finished, to meet with the Russians again in Washington to assure that we have communication and that the United States is in the mix of a deep negotiation with Russia. You have to separate out and compartmentalize wars and human beings. Brittany is a beautiful human being. Her family, wife, her mother and father, these are real people. And her plane colleagues, and yes, her Russian colleagues, who couldn't help. But we should welcome her home if she makes it, and Paul Whelan, with all the love that we can give. I will talk and go anywhere to ensure that the negotiations are continuing. Every day, I'm talking to the State Department about Brittany Griner and Paul Whelan. Now the negotiations are in process. I'll be speaking to them today, and we hope to get an idea of the next steps. The challenge of Russia is to do it quietly. I want to let them do it quietly. I'm happy to let them do it quietly. And that is the first call, to be quiet. And when I say quiet, to move diplomatically quietly, which is what I said yesterday to the Russian Consul General. We're prepared to be quiet, but we want the diplomacy and the negotiations to go now and be successful. Thank you. I'm gonna give this back to them. I don't want to take extra photos. Okay. Did he give you the thing? Where was it? Where all the paper? Sorry? Yeah, I'm back there in that office, in that little office I got back there in the back seat. I can't find anything. I get papers and what is all this? Thank you.
So you're going to give me exclusive, right, when you're here?
Then I get it. You're such a friendly person. What can I do? What can I do?
I always take care of you, Sheila.
Yeah. What can I do? It's good to see you, though.
Yeah.
I really appreciate it.
We're still here.
You are. Tell your producers to let that on. Did anybody put on the stuff?
It was going back to the station, so somebody should have been listening.
Okay. Did anybody do the one yesterday? I don't know who that was with.
I was there.
Yeah. Oh, you sure
It
were?
was me and
Right,
Courtney at the warehouse.
Oh, no.
On Main, like that storefront.